Assalamualaikum students. Today I am going to show the steps of dissection and structure of the front of the lower lip. So for the front of the thigh, what are the steps of dissection? At first, we will take a oblique incision from anterior suprailiac spine. This is the anterior suprailiac spine, and up to the pubic tubercle along with the inguinal ligament. Okay, so there will be an oblique incision. Then from the inguinal ligament, a curved incision along with the curvature of the scrotum up to the medial portion of the thigh. Okay, along with the curvature of the scrotum up to the medial portion of the thigh, one curved incision. Then we extend this incision up to the medial side of the medial condyle of the tibia. This is tibia. So this one is the medial condyle of the tibia. So from here we give an vertical incision up to the medial condyle of the tibia at the level of tibial tuberosity. This one is the tibial tuberosity. So up to this we will give a vertical incision. Then the skin will be reflected laterally. So what are the structures present in the anterior compartment of the thigh? At first, for the anterior compartment of the thigh, this muscle, okay, which is arising from the anterior suprailiac spine. This one is the anterior suprailiac spine. This structure goes to the medially. It is the sartorius muscle. Okay, this one is the sartorius muscle. This one is the rectus femoris muscle. Okay, anteriorly rectus femoris muscle, medially vastus medialis muscle, laterally vastus lateralis muscle, and below the rectus femoris muscle there will be vastus intermedius muscle. So these are the muscle of anterior compartment of the thigh. So what are the muscle I am showing again? This is the sartorius. Okay, sartorius muscle. It goes medially up to the medial surface of the tibia. So this one is the sartorius. This long muscle, this muscle is rectus femoris muscle. This one vastus lateralis, vastus medialis, and inside vastus intermedius muscle. These are the muscle of anterior compartment of the thigh. So what are the muscle I am showing again? This is the sartorius. Okay, sartorius muscle. It goes medially up to the medial surface of the tibia. So this one is the sartorius. This long muscle, this muscle is rectus femoris muscle. This one vastus lateralis, vastus medialis, and inside vastus intermedius muscle. So these are the muscles of anterior compartment of the thigh. So in the anterior compartment of the thigh, we can see the femoral triangle. Here will be the attachment of the inguinal ligament. These are the inguinal lymph nodes, and this is the femoral triangle. What are the boundaries of the femoral triangle? This is the adductor longus muscle. This is the sartorius muscle. So medial border of the adductor longus muscle and lateral and medial border of the sartorius muscle forms the boundary of the femoral triangle. So medially, medial border of the adductor longus, laterally, medial border of the sartorius. Base is formed by the inguinal ligament and apex is formed by the meeting point of these two muscles. So this portion is the femoral triangle. There is no extra point for dissection of the femoral triangle. Just we go for the dissection of the anterior compartment of the thigh. Okay. So what are the structures of femoral triangle? From lateral to medial, the femoral artery, femoral vein, and medially femoral canal. Okay, there will be femoral nerve. We cannot see here properly, but this one is the femoral artery, this one femoral vein, and here will be femoral canal. What are the contents of femoral triangle? femoral sheath. Okay, femoral sheath. What are the compartments of the femoral sheath? There are 3 compartments. What are the compartments? Lateral compartment contains the femoral artery with femoral branch of genitofemoral nerve. Medial compartment, intermediate compartment contains the vein, and medial compartment contains the femoral canal with lymphatics or lymph node. So these are there will be femoral sheath. For the anterior compartment of the leg, we have to extend the upper incision from the medial condyle of the tibia up to the lateral side of the leg through the tibial tuberosity transverse incision. Again, another transverse incision across the ankle joint or in between the 2 malleolus. Okay, then meeting point of these two transverse incision, then skin will be reflected laterally. So what are the structures present in the anterior compartment of the leg? At first we can see this one is the patella. Okay, here will be the tibial tuberosity. This one is the ligamentum patelli. This one is the ligamentum patelli. This is tibia. This is the medial surface of the tibia, which is there is no muscular attachment, which is subcutaneous. This is tibialis anterior muscle. Then this one is the flexor digitorum longus. Okay, these are the tendons of the flexor digitorum longus. Okay, then there will be the fascia. Okay, deep fascia. Deep fascia of the leg is called fascia pluris. Okay, deep fascia of the leg is called fascia pluris, and deep fascia of the thigh is called fascia lata. Here will be the fascia lata, and this one is the iliotibial tract. You can see a band-like structure. This one is a band-like structure. It is iliotibial tract. So this one fascia lata, and this one iliotibial tract.